Does chemotherapy kill? Have you heard of someone die from chemotherapy? Don't go away. Let's find out. Welcome once again. It's the World Breast Cancer Awareness Month.
Okay.
And as a general surgeon, they are the people that manage breast cancer.
General surgeon. That name, man.
It's general.
And is a misnomer.
President General.
It's a misnomer. It's specific.
Okay.
Before you know it now, the orthopedic surgeons will say somebody has a fracture and has extensive soft tissue in you, call general surgery. Why?
Yeah.
No, please, there's nothing like that. It's not everybody. Anyway, that's
not why we're here. You can make a case for yourself later. Okay. All right. So, breast cancer is the leading cause of cancer in women. And it's not only women that can have breast cancer. Men can also have breast cancer too, by virtue of anybody that has a breast tissue. Developed breast tissue can have breast cancer. But one good thing about that breast cancer is that it is curable. Even when a diagnosis of breast cancer is made, it can't be cured. So the focus right now is, apart from prevention, we know preventing cancers, preventing breast cancer, you talking about preventing a metastatic breast cancer, preventing metastatic breast cancer, which just means that you want to prevent the breast cancer from spreading to other places. And I know that there are different modalities. Even before treating, it must first be diagnosed. Talking about self-breast examination, clinical breast examination, and then several radiological radio diagnosis for breast cancer and all that. But we are focused on treatment of breast cancer, and there are people that have been offered mastectomy, that's the surgical removal of the breast, and then they are offered chemotherapy. But there's this fear about chemotherapy. But in this discussion is in the context of breast cancer now. I've had people say, I've even had cases that you had a patient, your patient having mastectomy and then refusing chemotherapy, things like that. So is the fear real?
Yeah, so I think we should narrow our discussion. We are talking about chemotherapy.
Yeah.
All right, because if you start discussing mastectomy and surgical removal, and that's another discussion. So chemotherapy, does chemotherapy kill? That is the question. Does flying a plane kill?
Yes, it does. It can. It can.
Yeah.
It can.
So you say if you fly in a plane, there's a possibility that there's a plane crash and the person dies.
Yes.
It's the same thing, chemotherapy. So the question, does chemotherapy kill? There's a possibility that someone takes chemotherapy and the person dies. But it is wrong to say that chemotherapy kills. Okay, let me give you another example. Somebody was going to the hospital because he felt sick.
Okay.
And as he was crossing the road to go to the hospital, he was hit by a car and he died. So they asked, what happened to him? This guy was fine, nothing happened to him. You know what they said? They said it's because he went to the hospital that he died. Because if he was not going to the hospital, maybe the car would not have hit him and he wouldn't have died. But it's wrong for you see, to say that he died because he went to the hospital. That's wrong. But if you want to look at it classically, that's what the person said. So chemotherapy does not kill, even though there's a possibility that either the condition the person is being treated for or a complication from the chemotherapy kills.
Yeah.
Okay. Now, let's start first. Let's pick the first one. That's the problem one is trying to treat. Like I tell patients, if you don't have a problem, you will not be offered chemotherapy. Or do you see someone on the road and just say, come and take chemotherapy? No. Chemotherapeutic agents are highly active agents that kill cancer cells.
Yeah.
And the principle is based on cell division, assuming that those cancer cells grow very fast.
Yep.
So they will be absorbed, the chemotherapeutic agents will be absorbed more than those that are the cells that are normal, and then they will die. But you must note that some of those agents would also be absorbed by the normal cells. And they will kill some of the normal cells, which include
that's what we see in terms of the people losing their hairs and all that.
So which means that it's going to weigh the body down, which is also why we have dosages for medication. Because anytime you are taking any medication, whether it's paracetamol can kill.
Yeah, every dog has the potential to kill.
Exactly. So which is why we have dosages. There are things we look at. We look at how fit this patient is. If you are not, if a patient is not
talking about preparation for assessment before even chemotherapy starts.
Yes, so that's one of the ways we prevent the complications of chemotherapy is by properly assessing the patient. It's not when a patient is at the point of death, you bring patient to the hospital. A well-trained doctor is not going to give that patient chemotherapy. What happens sometimes is that if chemotherapy is given to a patient that is not fit, the patient ends up dying. And then they say the patient
is the chemotherapy that killed.
Meanwhile, that's not so. The patient was already
on a downward trend.
Yes, and then that patient was probably not even fit for the chemotherapy
in the first place.
So the doctor, the well-trained specialist in the area of breast cancer now would assess the patient and say, oh, is this patient fit for this treatment? If the patient is not fit, no chemotherapy. So that's one. So meaning that many times when you hear that person took chemotherapy and died, it's not the chemotherapy that killed the person. It is what would you normally have killed the person. Maybe the person would have died after 1 year, but took chemotherapy and then died after 2 years. It's wrong for you to now say it's the chemotherapy that killed the person, because that chemotherapy, depending on the condition,
type of
and in breast cancer, depending on the type, because there are different types of breast cancer, the chemotherapy that you give and when you give it and the expected duration, will determine how long the person lives after the
survival.
Yes, after the chemotherapy. And it's well documented for different medications, for different conditions, for different types of breast cancer. So that's one. The second thing is about the side effects of chemotherapy itself, meaning that there are a number of counts in the body, blood level, the white cell counts that can drop when someone is taking chemotherapy. So it is also the duty of the physician to look out for those things and monitor the patient to make sure that those things don't kill the patient. So if you just take chemotherapy and walk away like nothing happened, then there could also be a problem.
And that will also, the communication is very important. Counseling before all these things start. You can't take that away, because the amount of understanding that a patient is going to have, or their relations, it will depend on how much information that has been given. You've talked about the pros, the cons, what we need to do. This is what is likely to happen, because based on this and this. So for example, you started chemotherapy for a person. There are different courses, there are cycles the person is supposed to get, and a patient goes away, does not return for checks, for monitor. It's a failure of communication. So communication is very key.
Just a few things that one should take note of when one wants to give chemotherapy. One, I've talked about the fitness. Fitness means that you want to assess how that patient is able to carry out their daily activities. So if a patient cannot stand up from the bed, for example, you have no business giving the patient some kinds of chemotherapy. It means the patient is not going to be able to cope with it. So that's one. Two, you look at the age of the patient. The age, chronological age, is not everything, but the physiological age is important, meaning that the amount of chemotherapy or the type of chemotherapy you can give to a 40-year-old is different from the one you give to a 90-year-old. It is worth it anyway.
Speaking of, is it worth it?
Yes. So
is it about prolonging life or improving the quality of life?
Yes. So because you must ask yourself, based on this breast cancer that this person has, is it likely that the breast cancer will kill the person? Or something else will kill the person before the breast cancer?
Two.
So if the something else is going to kill the person before the breast cancer,
and then weighing the risk versus the benefit.
The specialist, these are specialist thought processes. It's not something that you just say, someone somewhere will just say, just go and take it. No. So those considerations are very, very important. So if there's no benefit, then why should you take the risk? All right. So we look at the age of the patient. We look at what other treatment modalities are available. It's not everybody that has breast cancer that takes chemotherapy. So depending on how early it is, depending on the kind of cancer it is, like I said, cancer is not just one thing. So there are some cancers that will respond to other medications that are not chemotherapy.
Some types of breast cancer.
Some types of breast cancer that will respond to other medications that are not chemotherapy. So if I can avoid chemotherapy,
why not?
Why not? I will avoid it. So those are the key things to look at. So generally speaking, we've talked about Nigerians asking people that are not qualified about their health challenges. It is wrong for anybody to ask you that the doctor said they want to give chemotherapy, and then you tell the person, the person I know that took that chemotherapy, the person died though. Automatically you are telling the person,
individual.
Meanwhile, you actually don't know why that person died. So the person might have died from something else. Meanwhile, you know the person took chemotherapy at some point and died. You have attached the chemotherapy to the death of that person. So this other person is now going to run away because of your advice, will get worse, and then at the point when the person is about to die, comes to the hospital and is requesting for the chemotherapy.
It's too late.
And it cannot be given.
So
let's remember to always give the right advice. If you don't know something, don't pretend that if you know it. Don't give people false information. Don't say, the person I know, this one happened to you. Just like the example I gave at the beginning. The person I know that went to the hospital, the car hit him on the way. So don't
go to the hospital. No, doesn't make sense.
So let the person be evaluated individually. In fact, we have seen people that we think they are moribund, but you start treating them and they improve remarkably.
I remember that particular case of yours that people had gone to several places and they didn't take that woman on. Today, how many years after?
Yes, at least it's 3 years after.
3 years after.
So there are so many, so I don't think we should even go into
so what we are trying to say that you can't give a blanket statement that chemotherapy kills. Please go seek counsel from a specialist, from the right doctor. Usually it's the general surgeons that
there are many specialties, multidisciplinary. So we have the general surgeon,
oncologist.
So I prefer to say the breast surgeon.
I started
by saying just say general surgeon. So the breast surgeon. Then there is the medical oncologist.
Yes.
There is a surgical oncologist.
Yeah.
There is a radiation oncologist.
Yes, radiation.
So those are essential parts, of the treatment.
I'm going to take you on that. I'm going to take you on that. And then I come in too as a lifestyle physician.